Nice to have you here. Thank you very much for coming. Jan, thank you for this keynote also. We welcoming on stage for the first time then Eva-Maria and Brian. Thank you very much for being with us today. Today we're going to speak about the clinical AI shift, how hospitals are moving from pilots to practice. We hear a lot that we have a lot of examples, a lot of use cases coming around in different spaces, in different zones. We have like grassroots innovation everywhere. But the idea is like how we do with this innovation to have them scale at some point. How do we use it in the clinical practice every day and at scale? This is what we will treat today in our panel. But maybe to speak about that, I will give the mic to Eva-Maria first, doctor. My first question for all of you will be like, why today can't we scale easily? What are the challenges? Why we can't just scale?
I think we can, but there is almost like too much choice. There's too many things we could be doing, and often the things we can scale today are the less sexy ones. It's the workflows. And in general, when we think about AI, we think about the amazing things also Jan just showed, like the multimodality, the being able to support the doctors in making better diagnoses, to potentially find things earlier than we can today. And all of this will come. But what we can do today, what's ready for scaling, is a lot of the workflow automation. It's really looking at the things that are happening in the hospital every single day. How can we use technology to automate this? And it goes beyond the old business process automation, which was like an if-then logic, because our world is an if-then, and agentic capabilities can give us that flexibility to really kind of go into, and this can be things like note-taking. I think Jan also showed how much time people are spending on their computers. That is mature, that we can scale. We can scale like some of the billing processes in the back, which again are like freeing people up. We can do some of the procurement processes, some of the stock keeping, so you have the right things on station when you need them. And I think that's the first step, but it's really about kind of almost taking a step back from like the cool, shiny things to the little bit more boring, mundane things, but these are going to deliver value now, and they're going to opening up then more avenues to kind of go down the more ambitious paths.
So like pick up use cases with fast value, like that's the idea.
Yeah, like fairly simple use cases, which then can also deliver value on a short time scale.
Got it. And Jan, on your POV as representing a medtech, how do we stand in healthcare for AI adoption?
So, I mean, as I said, I think compared to other industries, we are rather slow, but again, for a good reason. But saying this, it's not like we're just starting with it. AI is here for many years, right? When I think about the medical technology space, when I think about imaging, some of my examples I shared, for instance, deep learning is part of MRI machines since a few years now, helping to reduce scan times, so when with this improving patient experience, for instance, or a specific example in cardiac MRI, we now use deep learning as well to reduce the need for multiple breath holds of cardiac patients, which are really sick, right? And it's hard for them to hold breath multiple times. So we can reduce this even to a point that they can breathe freely during an MRI scan. So a huge benefit for patient experience. So just two examples. So it's nothing new, but I think we have been focusing so far on use cases in healthcare, which are more like in the computer vision space, which is something that is, and don't understand me wrong, relatively easy to do. The more difficult, but
why is it easy to do? Maybe why is it easy?
I mean, because in computer vision and in healthcare and radiology, for instance, we have quite solid ground truth, right? It's easy to build those models. What I'm saying is the more complicated, but the higher value use cases are maybe not in the pixel and imaging domain, maybe they are elsewhere. And this is something which is more difficult to do, but from a technology standpoint, the tools, the capabilities are here today. We just have a couple of other, let's say, issues and things that slow us down as an industry.
And Brian, in your POV, what usually blocks this scaling? Like, what usually blocks this pilot to scale at some point?
Hi, yes, thank you. So typically what I've seen in some of the experience I had is similar to what Jan was mentioning. AI has been applied to a lot of computer vision problems today and does a really great job at that. But we find some of the untapped use cases, which we were discussing earlier, have a lot of traditional IT behavior behind it. So there's a lot of security models, traditional IT models that are in place that AI has a challenge in a lot of cases breaking down those barriers. You have to work with the CISO, you have to work with database operators. Working through that takes a lot of work, and typically a good approach is to have a good strategy. Having a strategy that really lets you understand how you're going to access that information, how you're going to access the people to get to that information, the subject matter experts is really important. We found that in the experience we have and with working with hospitals. In addition to that, another key advantage, if you have what we call a data fabric in place, it allows you to have a single namespace to allow you to go through your entire data estate. It makes it a little bit easier to access that data to your AI experts. Because an AI expert that's actually dealing with the use case doesn't typically want to deal with all of the IT barriers that get in his way. So we find that that's very helpful.
And you're speaking about like the access of data. Like, isn't it like something that blocks sometimes the access of this health data? Is it like something?
There are a lot of restrictions in place, a lot of compliance reasons, but even still, it's both structured and unstructured data, and it's the unstructured data that's out there that you typically really need to know what the information is about to make sense of it. But if you can at least get to it, now you can start applying AI models to it to extract that information to give value to the patients.
So now, for example, like to give some ideas, let's imagine I'm an IT director of a hospital. I want to bring a pilot and then see my fellow hospitals of my country, let's say France, for example. How do I make my pilot scale in France and then maybe in Europe? Do you have like some, I don't know, special key element that we can use? Maybe starting with Eva?
Yeah, I think what Brian just said is really important. It's the strategy. So whatever you get started with should be part of a bigger picture. And so it's really thinking through what is the end state, having a compelling vision of the end state. And as I said, that will have multiple components. It has the components of what you do. So as I said before, it should definitely have a component of process automation, because that's what's going to get you a fairly quick return, and it's going to kind of make a case that this is worth doing. But then it also will have a second element, which goes more into AI as an assistant, AI as some system which can support humans and can up-level humans in their work. So that's where we get more into diagnostics. That's when we can do those superhuman feats of seeing like 50,000 or 500,000 images in a single setting. That's where AI can really augment. So it's combining the two watts of like really process automation with the more assistant capabilities, and that's not just for the doctors, that's for people along the entire value chain in the hospitals. And then also the how, like what do you need as an infrastructure architecture, and how can you get started with something that you don't piecemeal, but it's a unified one package which you can then roll out, and where you have a blueprint which you can then give to other hospital systems to say, okay, here, this is what we're trying to do, this is the roadmap, these are the different streams, this is where we are, and here you can get started too and kind of get on that same journey.
And maybe like as a physician, I'm just also wanted to ask you the question. How do you convince people, like, because it's a lot of change management at some point. What is like the discourse, like what is like some key element we can use to convince a physician to use it? Because there is a lot of question about like how we evaluate the quality of the models. There's no like big framework about it, like for example in Europe. How do we inspire those physicians?
I think change management is not just a part, it's a huge part of this effort, and it mustn't be like an afterthought. It needs to be baked into this, and often you have to start to think about what's in it for people, and that's one of the reasons why the ambient listening use case of kind of helping people take their notes in a better way is so nice, because Jan knows about this better than me. I'm not a medical doctor, but you don't become a doctor to take notes. You become a doctor to help people. So if you have somebody who does the note-taking for you, why wouldn't you use it as long as you kind of trust that this is okay? And this trust needs to build. So probably if you're phasing it in, you'll have an initial phase where you still give people the time to compare and make sure that whatever is in the system accurately reflects what's being said. But we all know, like, once familiarity builds and once we figure out, okay, this is really doing what it's supposed to do, we're willing to trust it. We might still occasionally do like a check-in, but we're fine with letting it go. And I think that's the way. You basically have to find things that solve real problems for the people you want to adopt the technology. And real problems is not me as the person running the hospital, I want to save 5%. That's not a real goal. But it's like, okay, how can I make real world problems for the people using the technology? How can I make their life better? And then how can I address their fears in a structured way? And also, not everybody is the same. There are some people who have more influence. There are some people who are more willing to try new things. And so you have to find also these champions and start building like a self-reinforcing system.
And maybe because, like Eva-Maria told about like adopting technology, using technology, you as like a technology actor, also like HPE, how do you help hospitals taking care of it? Like, how do you help hospitals taking their infrastructure? Like, how do you accompany them for this?
Oh, certainly. So from an infrastructure perspective, HPE is taking the approach to partner with Nvidia specifically around delivering infrastructure. Our whole idea is to bring AI to the data. There are a lot of restrictions that hospitals have, so we've taken an approach where we've delivered a product called Private Cloud AI. And it's all around giving the full stack approach to a hospital or any medical industry. It's designed to deliver time to value. So it's a turnkey system, turn it on, get it going, and you can start working with the AIE enterprise stack that's delivered out of the box. So you can instantly get to writing your ML pipelines, writing your agents to address specific use cases. So that's been the focus for us. And in addition to that, we know we can't do it alone. Infrastructure and the platform is just one layer of the solution. The other part of it is working with partners. We have with HPE, we have this program called Unleash AI. We have over 50 plus partners. Over a dozen are in the healthcare space, specifically designed to address certain use cases because this is not our specialty. So that's what our approach at HPE has been, to partner and work on that.
And so it's not your specialty, but you're surrounded by experts like this.
Yes. I am not a healthcare expert, and to Jan's point, 1 in 10 cases going to a hospital is dangerous. I want to up that number with technology wherever we can.
But it's pretty interesting. Like, for example, let's say you're working on a pilot to make it scale at some point. What would be your dream team from HPE? What are the people surrounding you to make it adopt in this hospital?
So a key around that is finding the right talent or the right partner. There are a lot of scenarios where compliance or regulation can slow you down. And depending on your team, you could take the slow path or you can take the path of resistance. It's going to be painful to get that work done, but if you have the right AI people on your team, they will see that as a challenge and they will step up to get that done. Or if you have the right partner to get that work done, they'll find ways to get it accomplished. Especially in the AI space, it's evolving weekly. Jan had mentioned a little bit earlier, agentic interfaces. This wouldn't be an AI conference unless you talked about agentic. We at HPE are developing a technology called GreenLake Intelligence. So we're building out a set of agents to manage our infrastructure. And the whole security model around MCP is evolving, whether it's OAuth 2.1 or whether it's task-based security. These are things that us as technology leaders are helping to define. And once they are defined, I think it'll help the healthcare industry quite a bit.
That's very interesting for this POV. And I wanted also to ask you, Jan, like in regards on what they said, we're speaking a lot of like using AI for the physician, and we know that sometimes there's a bit like of I don't know, challenging for people like being like, okay, is this model mature? Is it okay in the governance? How should I use it? I'm a bit afraid of AI. You know, this kind of thing that you may see as a head of AI advocacy. How would you help a pilot to scale in terms of people adopting and trusting AI at some point?
Yeah, so we already talked about like setting a vision, having a strategy. Governance is another big aspect, right? When I think about those kind of latest generation of AI models, we also need to start thinking about what is called model monitoring or post-market surveillance, right? Making sure those models do not degrade over time. We don't see model drift, data drift. That's something we have not been doing to that extent in healthcare so far, but something we have to get started as quickly as possible. But to your point, when we start talking about AI, especially at events like this, we often start immediately a technology conversation. But AI in healthcare is so much more. Yeah, it's about the people, and therefore what we need to make sure is we upskill our healthcare professionals, nurses, clinicians as well, to be able to have a chance to be successful in the future of AI-enabled healthcare. So therefore, what we are, for instance, doing at GE Healthcare is we are running an AI literacy program. If you want to have a look, helloaiprofessional.com, where we provide a variety of different courses specifically for clinicians and healthcare professionals to equip them with the knowledge, the skills, and the mindset to thrive in the era of AI-enabled healthcare.
I think that's so important because I think there is this element between use cases and education, and like you cannot direct everything from the top. Like the people who are out there on the front line every day, they know where the problems are, and by educating them, they get empowered to actually identify those use cases where AI can be helpful. And then by solving them and by building their knowledge, they will find more and more and more use cases. So I think this is really, really important.
I was going to add to that. I totally agree with you. At least in the technology space, we have an acronym for that, HIL, human in the loop. We have that when we're defining the use case, when we're going through delivering the outcome, we always make sure there's a human there. Because right now it's a new technology, you want to make sure of the accuracy before you proceed, and that'll gain trust over time.
Human in the loop, like in the AI Act with the control of human, also that's really important, and also it's about people at some point, and the physician, the patient, and everyone in the loop. Also, I wanted also to ask you a question. Quick thing I heard in a round table I moderated on this very topic, a bit different, but like a few months ago. And some of the panelists mentioned the fact that physicians don't really know the component of a drug when they prescribe it. So why would we always want to explain an algorithm because we cannot understand it? As a physician, can't understand the pharmacodynamic of this. Why would we want a physician to explain AI at some point? What's your stand on this? Like, should we explain everything or should we trust?
So, if I may, we don't need to explain everything, right? But I think we need to explain when a physician needs and wants an explanation. So like a turn on, turn off kind of capability. Yeah, because you also do not want to, impact like latency on inferencing, for instance. Yeah. But I think when physicians require explainability or transparency, we have, as technology providers, we have to provide it, because what is very important in our space as well is the sheer fact that at the end of the day, when a diagnostician, for instance, makes a decision based on AI outputs, for instance, they are liable, right? They are in front of court if something goes wrong. And therefore, as technology providers, I think we have a responsibility to provide explainable solutions whenever it's required. Not always, but whenever it's needed.
I think we also just have to accept a higher bar in terms of accuracy from a machine than from a human. And that has some philosophical reasons, that we're just actually, humans make mistakes, machines, we just expect more of them, but also I don't know, it's probably not the right word to say in a healthcare panel, but the blast radius is so much bigger. Like if a human makes a mistake, it affects the one patient sitting in front of that human. If an algorithm makes a mistake and it's rolled out to hundreds of hospitals, this is going to affect thousands, 10,000s of patients. So I think that's also we'll just have to accept that the bar is higher. Like something like a diagnostic and accuracy we're happy to accept from a human is not going to cut it for what we're going to accept from a machine.
Not scaling the mistake itself at some point. That's the point.
Yes, especially in the IT industry, we always make sure we give a full audit trail. And especially now with AI, there are mechanisms. You can use NEMO guardrails to put guardrails around it if you change your model under the covers. So it's super important that we do this in this industry to gain that credibility we were talking about earlier. And because we can do it, we might as well, right?
So we're arriving a bit at the end of this roundtable. I just wanted to ask you like an open question on what's your vision, what's your view of the future of this, because how do you envision this clinical AI shift? When, how, in some point, like what would be your prediction at some point for this? Maybe starting with Brian on this here?
Okay, you put me on the spot there. So I think it's happening right now, right? So you see it in pockets. There's probably a lot of shadow AI that's happening in your organizations right now. It's a little bit uncontrolled, but you don't want to stifle that innovation. Back to that comment I made a little bit earlier about having the strategy. Having a clear strategy in your organization will help accelerate it quite a bit because you can narrow down on consistent tools across your org and start building some momentum. You can start finalizing which models you're going to use because working with models results in different behavior depending on the model you actually use. So that's important too. So really nailing down your approach and having that strategy, I think, would be key to making this proliferate, but we're in it now. So
I would second this. I think we're at the stage now that we can see what's coming from all sorts of different directions. We have the equipment manufacturers who are like a natural platform for more diagnostic algorithms. We're having independent software vendors who are integrating agentic capabilities. The roadmaps are out there. Basically, we can extrapolate how fast is what coming from what direction. And so I think the task for the hospitals is or for also the systems, the health systems, is to take this in and so say, okay, now what is the integrated vision of the hospital of the future? Like where is what happening? And then what do we need to do in terms of data infrastructure, in terms of compute infrastructure, in terms of network infrastructure? Apparently there are still hospitals where you have to take a CD with your MRI scan from the 3rd floor to the 5th floor because there is no data, no network infrastructure in that hospital. So really think about it holistically, like what's coming, what do we need to make this happen? And then don't forget the change management.
Yeah, so what I said earlier, I think 2025 has been a tipping point. I also believe and I hope that healthcare professionals, clinicians will be incredibly well served by AI over the next decade. It's going to be a transformational impact to how we operate healthcare as a whole. And therefore, all of us working in the healthcare industry, every clinician on the front lines, every nurse, my recommendation really is to lean into this technology. Yeah? Get hands-on, play around, explore those tools that are out there, that are available to you, see how they can help you, see where the gaps are, see where they maybe still hallucinate, but figure out and learn about them yourself. Yeah? And I think this is the way to go, lean into it, and if you do so, and if you get up to speed on this technology yourself, hopefully it's going to serve you very well going forward.
And maybe the last word, because we have like 1 minute, we spoke about like the clinician, the physician, and the whole infrastructure. I want to ask you like really quick each, do you think that patients could sometime at some way ask their physician to be like, will I be taken into charge by an AI? And like they could ask it?
There's a question whether you might, is it going to be at some point unethical to not use AI? So I think that's the more interesting question.
I would agree. Even today, my wife will take some of her medical records, put it into ChatGPT to ask what the results would be. And, again, she'll back that with an actual doctor, but it's good to at least get some initial feedback, and it does a pretty good job depending on the context window of the model. So,
No, and yeah, I mean, there are very practical use cases already today where we see that AI does help patients tremendously. For instance, there was just a recent research published that patients perceive communication from chatbots over communication from their healthcare providers. Yeah, not just in terms of quality, but also in terms of empathy. And this is something we have to watch very closely as healthcare professionals. I always thought this is like the human domain, this is where we have to excel in, but AI is catching up, so we need to watch that space as well.
Thanks a lot for sharing your expertise being with us today. Please give them a huge round of applause.